So we're going to give this another minute for everyone to filter in here, and then we'll get started. All right, 101, we're going to go. Welcome everyone to the CoverRight Medicare Madness webinar. And yes, for those who are curious, we did choose this title because of March Madness in college basketball. It was not a coincidence. When this is over, you will be informed and hopefully less confused about Medicare. As I mentioned, we're recording, so we will make the recording available after. If you have questions, put them in the Q&A section and we will address them during the webinar. If anyone has any specific personal questions that they prefer not to ask in an open setting, you can email hello@coverright.com and someone will get back to you with personal advice and suggestions. This is the first in a new ongoing series, so check back monthly, and we'll be doing more of these events. My name is Joseph. I'm going to be the moderator. I head up marketing for CoverRight, and I'm excited to host you all and our panel. We have a lot of information to cover, and the plan today is for our CEO, Richard, to give a 2-minute presentation about CoverRight, and then our co-founder, Tom, to do a deep dive into everything Medicare. So let's first welcome Richard Chan, who is the CEO, co-founder of CoverRight. He's also a content writer, licensed insurance agent, and focused on Medicare. Based here in New York, he's passionate about empowering consumers to take control of their health and finances. Richard has extensive experience working in financial services with over 8 years in the industry. Richard, let's go. It's up to you.
Perfect. Well, thanks, Joseph. And again, thanks everyone for joining. My name is Richard, co-founder and CEO of CoverRight. This is our first webinar, as Joseph said, so I'm really humbled that so many of you have joined us for this first session. Hopefully we'll be able to deliver a really engaging and informative session for you all. We do intend to do this going forward, so you might see some questions throughout the presentation asking for some feedback, and we definitely welcome that. This is an educational webinar, so I don't want to take up too much of your time before handing to Tom. There is an agenda which we had laid out on the webinar registration, but I wanted to give you all a quick overview of CoverRight before we get started. So who is CoverRight? CoverRight is a technology startup. We are the first purpose-built digital concierge platform for Medicare. And our mission is really simple. We want to make Medicare as simple, transparent, and accessible as possible for people like yourselves, as well as 60 million other Medicare recipients in the US. And I'm really proud that we've assembled a really passionate team of innovators here who are driven and excited by helping people to make the best decision on their healthcare. What does this practically mean? Well, you know, our platform has previously been dubbed TurboTax for Medicare. CoverRight's platform is 100% free. We give you online educational tools, calculators, in order to help you find the perfect plan for you. This means you can search your doctors, you can match your drugs, you can look for extra benefits, and our platform will give you the best recommendation based on your inputs. We also have sophisticated recommendation engines that would actually help guide you through the best combination of plans. And that's something that Tom will walk you through today to give you more information on as well. And that can get complex as we get into the weeds. In addition to that, we are also your Medicare concierge. When you use CoverRight, you get one dedicated licensed expert from beginning to end. There's no pre-recorded lines, there's no call centers, and there's no switchboards. Your dedicated expert is with you along the whole journey. You can speak to them as much or as little as you want. And if you're lucky, you actually might get Tom or I as your agent. In addition, all our services are 100% free. There is never an obligation to enroll. And importantly, we never redirect you to any other sites or sell your data. Everything is stored in HIPAA compliant secure storage. And really, that's it. There's more information on us at CoverRight.com. We'll also send you a follow-up email after this session. But you know, with that, let's get started on the nitty-gritty. I'll hand you over to Tom, my co-founder, who will be walking you through the session.
Thanks, Richard. Let me give Tom his due and introduce him. So Tom is, as you mentioned, CEO, COO, and co-founder. He's also a content writer and a licensed insurance agent focused on Medicare, also based in New York. and experienced in the financial service and consumer retail industries. He's passionate about helping people save and make the right financial decisions. Tom, thanks for making the time. The floor is yours.
Awesome. Thank you very much, Joseph. And hi, everyone. It's great to be here. I'm very excited to go through our first webinar today, and I'm looking forward to making this a long and successful series as well. So as Richard said, let's move on to the kind of nitty-gritty of our presentation today. So making sense out of Medicare Madness, as we say. So a lot of our audience today is probably thinking about enrolling or soon to be enrolling in Medicare, and that's why you're here, and we're looking forward to helping you learn more about the process. Something you might not know, though, is that the average consumer has over 60 Medicare options to choose from. So there really is an abundance of choice, and that number is growing every year as well. And so there's a lot of decisions that need to be made. So 73% of people, it's been found, who use the government website, Medicare.gov, are confused by what they see and by the plans available. And there's a couple of other statistics here. One that I think is pretty impactful as well is that 68% of consumers don't understand the different elements of what is covered by the various different plan options that are available to them. And so my goal today is to help you demystify Medicare and make sense of all the key ins and outs of the different parts of Medicare and the different options available to you, so that you can walk away with the knowledge required to undertake this Medicare journey and find the coverage that works the best for you. So as you probably know, Medicare is the government-run health insurance program that becomes available to most Americans when they turn 65, and to some who are under 65 but have a disability and are receiving disability support benefits for 24 months or more. The basic part of Medicare is called Original Medicare. It's made up of two parts, parts A and B, which we'll cover further on the next couple of slides. And once you have Medicare Parts A and B, you can then enroll in other types of coverage, such as a Medicare supplement plan, prescription drug plans, and Medicare Advantage plans. So we're going to focus on the left-hand side here, or the original Medicare option first. So Medicare Part A is hospital insurance. So this provides coverage for services that typically require an inpatient admission, such as inpatient hospital stays, skilled nursing facilities, and hospice care. Most people will sign up to Part A when they first turn 65. And this is what we recommend, since Part A is typically premium free if you've worked for a certain period of time, and will act as secondary insurance to any other existing insurance that you currently have. And under Part A, the main out-of-pocket cost that you have is the Part A deductible. And you must pay this deductible, which is just over $1,500 in 2022, for each hospital stay that you have effectively. So if you have multiple hospital stays during a calendar year, you can be subject to paying this $1,500 more than once. So that's part of the reason why it makes sense to look at additional types of coverage. Moving on, Medicare Part B is medical insurance. So this covers outpatient services like doctor visits, ambulance transport, medical equipment, and other services that you would receive outside a hospital, like visits to outpatient surgery. Now, unlike Medicare Part A, Medicare Part B does have a monthly premium, which starts at, in 2022, $170 per month, but can be higher depending on your historical income level. Now, the key out-of-pocket costs for Medicare Part B are really what will end up kind of being your main out-of-pocket costs under Original Medicare. So there's a deductible that's a lot smaller under Medicare Part B. It's only $233 per year. But then you're also obligated to pay 20% of your medical costs for the Part B services that you use, like those doctor visits, ambulance transport, and outpatient surgery, etc. And so obviously at 20% of those total costs, this can add up quite quickly over the period of a year. moving on to Part D. So Part D is prescription drug coverage. So this provides coverage, as it says, for prescription medication. Part D plans, you can either buy a Part D plan as a standalone plan or as a bundled or bundled with a Medicare Advantage plan, which we'll cover in a second as well. Our monthly Part D premiums can range from under $7 to $99 or more per month. This is for a standalone plan. And what's really important and what a lot of people don't realize is that's just the monthly premium before you pay for any prescription drug medications. So then you typically pay a deductible under standalone Part D prescription drug plans of between $0 and $480 in 2022. And then you pay, like I just mentioned, a copay or co-insurance based on, for your medications, based on the tier of that medication. So most prescription drug plans have 5 tiers. And as you increase in the tier, the medications typically become more expensive. And the cost that you pay is also dependent on where you purchase your medications, whether that's from a retail pharmacy or mail order. And so it's important to assess where you're going to purchase your prescriptions and get a really good understanding of what they're likely to cost at different types of pharmacies. And Part D plans cover medications according to what's called a formulary, which is something you might hear. This is a list of medications that's covered by the plan. And likewise, it's important to review the formulary of any prescription drug plan, whether standalone or bundled with a Medicare Advantage plan, to ensure that your particular prescription medications are covered by that plan. Okay, so the last and optional part of the kind of original Medicare stack that we've been going through here is Medicare supplement plans, or otherwise known as Medigap plans. These are insurance policies sold by private companies that are designed to help you pay for the out-of-pocket healthcare costs or gaps that aren't covered by original Medicare Parts A and B. So there's officially 10 different types of Medicare supplement plans, which sometimes confusingly also have their own letter designation. However, most beneficiaries will choose from one of the 2 most popular plan types, which are Plan G and Plan N. Now, these popular plan types, Plan G and Plan N, typically have a premium, a monthly premium that you must pay in the region of $90 to $300 per month. Now, that varies a lot because it varies based on your age and also based on your location. So different states around the country, just like everything else, have different prices for Medicare supplement plans. Now, with a Medigap plan, and specifically with the 2 most popular plans, the Plan N and Plan G, your out-of-pocket costs really are limited to the monthly premium and then the Part B deductible. Under any Medicare supplement plan that's available to new beneficiaries, you still need to pay this $233 Part B deductible each year. But then under the most popular plans, so under a Plan G, for example, you have no out-of-pocket costs following that. And then under Plan N, you have some minor copays for doctor and emergency room visits, and that's your only out-of-pocket obligation. So that's it for the left-hand side of this page here, the original Medicare stack. An alternate way that you might get your Medicare coverage is through a Medicare Advantage plan. I'm sure everyone on the call today has heard of Medicare Advantage plans, and these are rapidly growing in popularity. And some of them are starting to offer some really exciting new features. And so I'm going to step through some of those today and talk you through how a Medicare Advantage plan works compared to original Medicare. So Medicare Advantage plans are also known as Part C plans. And these plans are also private health plans that combine Medicare Part A and B into a bundled package, which often also includes, as we said, Part D, that prescription drug coverage. So you don't need to purchase prescription drug coverage separately. And then they also include extra benefits like dental, vision, hearing, and lots of plans also offer fitness benefits as well as medical transportation. And some really exciting new benefits that are coming out are over-the-counter allowances to allow you to purchase items at a pharmacy that aren't prescription medications. And then also flex cards, which allow you to adjust the benefit amounts on some of the other included benefits so that you can increase those benefits and maximize what's most important to you. Okay. Now for Medicare Advantage plans, the monthly premiums can range from $0 to over $100 per month. So there is a range in the cost of the plans. However, you will likely have heard of these $0 premium plans, and that's because 59% of all Medicare Advantage plans have a $0 monthly premium. And almost all areas of the country where you can get a Medicare Advantage plan, you can find a plan that has a $0 premium. So they're available to almost all beneficiaries around the country. Now, under Medicare Advantage plans, you do have a range of out-of-pocket expenses and obligations that you need to pay. Some plans have a medical deductible, which is similar to the Part A and B deductible that we talked about already. This is an amount you must pay out of pocket before the plan's coverage really kicks in. And then what you will likely have heard of is the co-pays that you must pay for different services that are covered under the plan. So under most plans, you pay between $0 and $50 for doctor visits, and then you might pay between $250 and $600 per day for stays in a hospital, usually for just the first 3 to 7 days, and then the rest of your stay is covered. You'll also pay other out-of-pocket costs for things like lab tests, x-rays, important scans, other outpatient surgeries as well. But what's important to remember is all Medicare Advantage plans, they also have a maximum out-of-pocket limit or a maximum cap per year. And this can range from $3,000 or even less in some areas to over $11,000. And what's important to remember is this is the total amount that you will spend in a year before the plan covers the rest.
Tom, I think Richard may have some additional points he wants to make on Medicare Advantage.
Yeah, and just a few points to add to that. So when you go into a Medicare Part C plan, it's important to note that that is an alternate to original Medicare. So we have the left-hand side and the right-hand side. It's important to note when you go into a Medicare Advantage plan, what you are actively choosing to do is to take your Medicare coverage directly from that insurance plan. So from United Healthcare, from Humana, from Aetna, these private companies that provide the Medicare Advantage plan, versus directly from the government, which you are doing under original Medicare. And then the only thing other thing that I'd add on these key out-of-pocket costs on this slide here is that these basically replace those original Medicare costs that Tom talked about earlier. So the 20% co-insurance or copay that you have to pay for doctor visits gets replaced by a fixed dollar amount determined by the plan. So for example, $0 to $50. And that $1,500 hospital copay that you have to pay for hospital insurance under original Medicare gets replaced again by what the plan determines. So in this case, typically it's $250 to $600 per day for the first 3 or 7 days, and then normally it's like $0 up to 90 days. And so that's important to note. I just wanted to point that out.
Cool. Yeah, thanks, Rich. There are some good points, and yeah, it's important to remember that Medicare Advantage is an alternate way of getting your healthcare coverage. That's right. And so moving on from here, what we'd like to cover next is really why Medicare is not one size fits all. So we talked about we talked about the 2 different ways that you might get your Medicare coverage today. And what we'd like to talk about, or what I'd like to talk a little bit more about now, is which plan might be right for you for various different reasons. So the first one, the first point here that I'd like to make is regarding your access to doctors and providers under the two different types. So under a Medicare supplement plan, because you are still getting your coverage through original Medicare, that makes up your available network of doctors and providers. So you can use any doctor that accepts Medicare. And something you might have heard of is that under Medicare Advantage plans, on the other hand, you do need to use in-network providers in order to get your healthcare services. Now, some plans, PPO or preferred provider organization plans, they do allow you to see out-of-network providers, but they can still be limited, and they typically come at a higher cost. And so it's usually more beneficial to use those in-network providers. The second point here is that under Medicare supplement plans, your annual out-of-pocket costs can be limited, and under those most comprehensive plans are really limited to just the cost of your monthly premiums plus that annual deductible. And then the plan pays or covers those gaps under original Medicare, so that you don't have to pay anything out of pocket when you seek healthcare services. But what that might mean is that you end up paying more across the period of a year than if you didn't have to pay that monthly premium. And so that is the case under Medicare Advantage. So this is kind of the opposite case here. You typically don't need to pay a monthly premium. As we said, 59% of plans don't have a monthly premium at all. But you pay for those healthcare services through the co-pays and co-insurances as you go, and you only pay for them when you need them. So it can be a more cost-effective option. The next point here is, again, regarding those monthly premiums. Medicare supplement plans will generally always have a higher monthly premium. So like we said, they start at $90 and they can be over $300 a month for the most comprehensive plans, depending on your age and depending on where you live. Whereas Medicare Advantage plans typically have a low monthly premium, and many of them have a $0 monthly premium. And the last thing to consider here is how important the extra benefits really are to you that are available under Medicare Advantage plans. So like I said, a lot of Medicare Advantage plans are really starting to offer some exciting extra benefits now, like the over-the-counter allowances and fitness benefits, for example. Whereas under Medicare supplement plans, you typically don't have access to those types of extra benefits at all. And so it's important to consider whether having things like some dental coverage, vision coverage, and other extra benefits is something that's going to be important to you with your healthcare coverage. So this kind of covers off on the main parts of Medicare and the kind of Medicare 101. What we'd like to do next is talk a little bit about a couple of common mistakes that we come across a lot with clients particularly clients who are new to Medicare and who might not have a great understanding yet of how the Medicare program works. The first mistake and potentially the most costly mistake is missing what is called your initial enrollment period. So the initial enrollment period is the period around your 65th birthday. So you probably know that your 65th birthday is when you become eligible for Medicare. And your initial enrollment period is the 7-month period around that month when you are eligible to enroll in Medicare. So that starts the 3 months before you turn 65, includes the month you turn 65, and then ends 3 months after that month. So it's a 7-month long window in total. Now, if you miss that period, you can still enroll at a later date, but you'll likely incur penalties that can be lifelong penalties. So for example, for Medicare Part B, if you miss that initial enrollment period when you were first eligible to sign up, but chose not to sign up and you weren't eligible for other creditable coverage, you can be penalized 10% of the Part B premium for each 12-month period that you could have signed up and didn't. Similarly, for Medicare Part D, so that's prescription drug coverage, the penalty is a little different. If you don't sign up when you're first eligible and you don't have creditable coverage, you'll be charged a fee or a penalty of 1% of the monthly national base premium, which is $33, roughly $33 in 2022, multiplied by the number of full months that you didn't have coverage. And so what's really important to remember is these aren't just one-off penalties. These are penalties that will stick with you for the whole time, the entire amount of time that you are signed up for Medicare, which for most people is for the rest of their life. And the second important mistake that we want to go through today is that you don't need Medicare. What we often hear from people is that they think that they don't need Medicare if you have other insurance coverage, which is not entirely true. So Medicare only allows you to defer your enrollment into Medicare if you currently have other creditable coverage. So you should always enroll in Medicare straight away once you become eligible. If you have COBRA or retiree insurance, if you have an individual health insurance plan, such as a marketplace plan, if you have short-term insurance or have no insurance at all, or if you have VA or TRICARE health coverage and you are currently retired. Now, if you are working past 65, it's recommended that you sign up for Medicare Part A as soon as you become eligible. So that's your hospital coverage, and that will typically act as a secondary coverage to any existing coverage that you have. Now, if you are working past 65 and your employer has more than 20 employees, that does mean that it's essentially the health coverage that you have under that employer is creditable coverage. And so you can defer your enrollment in Part B. And if your current health insurance plan has Part D coverage, prescription drug coverage that is considered as good as Medicare's, then you can also defer your Part D enrollment. But once again, if that coverage isn't creditable, it's not as good as Medicare's, then you should enroll in Part D once you become eligible. And so I think that pretty much covers it. Richard, I don't know if you wanted to add anything else there at the end.
No, I think there's a few questions here from people on the line. And
yeah, I'll help field the questions for you guys. So appreciate all that information, Tom. A lot of information. Obviously, the questions that are coming in are some specifics. So let me start with this first one here, and we'll see how many of these we can get through. We did block an hour, so if we need to, we'll use the whole time. So Sandra asks, she's 57, working full-time for an employer who provides health insurance. Her husband is 67. At 65, they opted to enroll in Part A only. And then now hearing, like you just mentioned, about potential penalties for Part B and D. Is that correct? And what is their best option?
I can take this one. So thanks for the question, Sandra. And this is exactly the type of question that we help people with every day. So it sounds like if your husband is still working, but he has already turned 65, then he just needs to check to see whether the coverage that he has through his employer is creditable. So if his employer has more than 20 employees, then it's likely that the coverage is creditable. And so he won't face a penalty for not having signed up to Medicare Part B or Part D, even though he's passed his initial enrollment period. But he'll just want to confirm with the company's HR department and ideally get a letter from them confirming that it is creditable. And that's what you'll need to present to Medicare once he decides to sign up for Part B and D.
So Sandra just wrote in that her husband's not working, but her coverage is through her employer. So
right, sorry, I misunderstood that. So if Sandra has coverage and Sandra, your husband is covered under that plan as well, it works in basically the same way through spousal coverage.
So the advice there in a nutshell is, Sandra, you should check with your insurance company, find out if it's credible for Medicare, and you should be okay if that's the case. That sum it up pretty well there, Tom?
Yep.
Yeah, excellent.
Exactly.
Jane asked the question, what if you want to continue your employer's coverage from a large company and have an HSA account? Is there anything specific that they need to do?
Yeah, I can take that one. So if you want to continue your employer's coverage, it's the same rules as what Tom just spoke about. So if your employer has greater than 20 employees, then you are free to defer your Part B, which is the medical insurance without penalty, and you're free to defer the Part D, which is the drug coverage without any penalty as well. If you have an HSA account, what we typically recommend people is, which you saw on the slides, is if you have Part A and are eligible for it, you should sign up. The only exception is if you have an HSA account. If you want to continue contributing to that HSA account, the government doesn't let you contribute to the HSA once you enroll in Medicare. So in terms of the Part A portion, you basically have to make a decision on, do I want to continue contributing or not? If you want to, once you stop, then you should sign up for Part A immediately, because it's, again, secondary coverage behind your group insurance, and we'll just give you that extra coverage if you need it.
Perfect. So we have another question for you guys. Michael says, I know if your birthday is the first of the month, Medicare starts the month prior. Does a birthday the first of the month impact when the window begins to enroll in Medicare? So if your birthday is October 1st, does enrollment begin June or July?
Yeah, if it does, if your birthday is on the first of the month, it does move that window 1 month forward. So if you're, for example, June 1st, your coverage can start May 1st, and your window, rather than starting in March, actually starts in February. So everything shifts forward by a month.
Excellent. So I've got some other questions here for you guys. We talked about these penalties, so let's go dig into that a little bit. If someone incurs a penalty for late sign up, is there a way to have the penalty removed or reduced, or is it a lifetime punishment?
Yeah, that's a good question. Typically, no. There's no way to have that penalty reduced. It exists for a reason, and it's to encourage everyone to sign up to Medicare when they're first eligible. There can be special cases where it can be reduced or removed if a claim's submitted, but we definitely don't see that very often, and we don't advise clients that it can be changed or removed.
Excellent. Well, not excellent. Excellent answer. Not excellent for someone who may incur a penalty. Robert just wrote in a question here. He's 73. He has Part A, and he has insurance through his company. He's planning to retire in June. How and when does he need to apply for his full Medicare coverage?
Yep. So, Robert, thank you for the question. It's important that you submit your application for Medicare Part B ahead of your retirement date. And so that should be active. You want your Medicare Part B to be active basically the day after, or the first of the month, as soon as you retire. So if you're retiring on May 31st, then you want that coverage want your Part B coverage to be effective as of June 1st. And while you're doing that, we can start helping you review your additional plan options. And we can line you up to have those additional plan options, like a Medicare Advantage or Medicare Supplement plan, effective as of the same date as your Part B coverage. Excellent.
Frida asked the question, if you lose employer coverage and don't want to sign up for COBRA because a new company gives coverage in 60 days from when you lost your previous coverage, how much time do you have to sign up for Medicare Part B for a spouse who's over 65 and currently only has Part A? And how do you sign up for Part B? What's the website you go to?
Yeah, I can take that one. So it sounds like your spouse is on your current work coverage and you're changing jobs, and so you have a 60-day window between your current and your next job, where you want your spouse to sign up to Medicare. Typically, once you lose that coverage from the first employer, your spouse will have to sign up to Part B within 8 months. There's a special enrollment window that opens up that allows them to sign up for Part B. Our recommendation, as Tom mentioned earlier, just for the previous answer, is that you line that up so that there is no gap at all. So you line it up so it's the first day of the month of the next month after you lose that employer coverage from your current employer. You also have 60 days, which is shorter than 8 months, to pick really a private drug plan or a Medicare Advantage plan. So you have 8 months to enroll in Part B, but our recommendation is do it, line it up so that it is on the first of the month after you finish. And also at latest, try not to do it any more than 2 months later than when that coverage finishes, because otherwise you sort of get into a situation where you can't enroll. To sign up, it's very simple. If you just Google Social Security Administration Medicare, there's an online application to sign up for Part B, and you can sort of fill out the form. And again, try to do that ahead of that coverage ending.
Got a couple more questions coming in here. I guess the conversation is getting people thinking, which is great. It's what we wanted to do. Yvonne asks, how do you choose your supplemental insurance? I know it's a little bit of a broad question, but I know you got some experience there.
That is a broad question, and yeah, that's something that I enjoy helping people with, to be honest, because it's an important decision, but there's lots of good options. So Yvonne, don't feel too stressed about making the or picking the plan, because we can help you make sure that you're picking a plan that works well for you. In terms of supplement plans, if you're talking about Medicare supplement plans in particular, most people do enroll in a Medicare Plan G, a supplement Plan G or a Plan N. Like I said earlier today, a Plan G is the most comprehensive. You pay your premiums each month, and then the only other out-of-pocket you have is that $233 deductible. And so they're great for people who are expecting some medical costs during the year, and also for people who are happy to pay that premium and don't want to worry about anything else, don't want to worry about any out-of-pocket costs, are happy to just pay that premium and use healthcare services when they need them. A Medicare Supplement Plan N is very similar. Really, the main difference is that you do have to pay a small copay to see a doctor. So it's up to $20 for doctor visits and up to $50 for emergency room visits. So that's on the Medicare supplement side. On the Medicare Advantage plan side, it's a little more complicated, and there is a little bit more to think about. And so I really want to dig into your preferences with you and understand what's important to you to work out which type of plan might be best.
Yeah, so we have I'm not sure we get to all these questions. This is great. Laura was looking for some clarification. She thinks the previous question we may not have answered fully. So let me see if I can explain what may be the confusion. She thinks the person was wondering if they have to sign up for Medicare because there's going to be that 60-day gap in coverage provided by the employer that also covers him, right? So there's that window.
Yeah, so it's really, you won't incur a penalty for not signing up between that window, because the Part B window is 8 months that you have to sign up for after that ends. So if you decide that you don't want to take Medicare, you are open to leave that 2-month window open. Obviously, make sure you have gap coverage in between for those 2 months. But there is no penalty as long as you make sure it is within 60 days. I think that's the key thing here. If you think it's going to be 90 days, you may incur penalties. So I would make sure that it's definitely within 60 days.
Yeah. So Laura, I think, if we haven't fully answered the question, maybe getting on the phone with us directly, we can work through the problem. You can reach us at hello@CoverRight.com. I have a question from Jermaine here. They'll be 65 in 2024. What's the window for sign up? I currently have a market plan. I don't have any retiree health benefits from my previous employers. I do contribute to a health savings account. I will have to discontinue contributing to that. Will I have to discontinue contributing to that account? And should I use those funds before signing up for Medicare? Does that make sense?
Yes, there's a few different parts to that. The first part is your window for signing up to Medicare, which is just the same as that initial enrollment period that I went through just then, which is the 7-month period around your 65th birthday, unless you are getting disability benefits before you turn 65. And then the second part of the question was just regarding the HSA. Is that right, Joseph?
Yes.
Yeah.
Do they have to use it? And I believe you said earlier you have to start. You can't contribute, and they're now asking, do you have to use all those funds?
Yeah. So typically, we would recommend that you do use the funds by the time that you sign up to Medicare, and you should, as Richard explained earlier, you have to stop contributing once you sign up to Part A. You have to stop contributing to the HSA.
All right. So
yeah, sorry, just to clarify there. So you do have to stop contributing. You are open to continue to use those HSA funds post retirement. I think sorry, we got the terms confused, but you definitely have to stop contributing because the federal government does not allow you to contribute to an HSA while you have Medicare.
So I got a couple of supplement questions here, and I have a business question. So I'm going to throw the business question out because I think it's important for everyone to understand the business model from a transparency standpoint. So James asks, do the health insurance companies pay CoverRight? If you make CoverRight free to individuals, how do we pay the bills? Just curious.
Yeah, that's a great question. So yeah, this is all on the FAQs on our website. So CoverRight is a licensed independent insurance agency. We are not affiliated with any particular carrier, but we do receive commissions when we help enroll you. That's how the service is free. However, we have a product and carrier agnostic model. So when you come on our website, because it's online as well, we show you all your options that are available in your area. You get to see the recommendation that our platform makes. And obviously we can't hide behind any recommendation because you can see all the information. So the short answer is we do get paid a commission. That doesn't impact the price that you get. The prices are federally regulated. So whether you sign up through us, sign up directly through a carrier, sign up through someone else, it's always going to be the same. So it doesn't impact the price. And it never impacts our recommendation. Our goal is to put you in the right plan, whether that's supplement, whether that's advantage, whether that's just a drug plan by itself.
Excellent. Robert has a question here, which I believe, Tom, you're going to enjoy answering. So I've heard that if you sign up for an Advantage plan, it may be impossible to change to a Medigap plan later if you determine the supplement would be a better option for you.
Yeah, that is a great question, and I'm glad that question got asked because that is something that's really important to consider, which is the fact that Medicare supplement plans have what's called a guaranteed issue window. That guaranteed issue window is it's typically 6 months from the time that you turn 65 or when you sign up to Medicare Part B, whichever is later. Now, in that window, you can sign up to a Medicare supplement plan without any healthcare screening or medical underwriting from the healthcare provider. They're required by the government to guarantee you acceptance into one of those plans. Once you pass that 6-month window, you are subject to a medical underwriting process. And that means that unfortunately, if you have had a moderate to serious medical issue, and there's a long list of conditions and health issues that we need to go through, a plan will deny you coverage. And it can make it very hard to sign up to one of those plans later. So if you do sign up to a Medicare Advantage plan when you first become eligible, and then you decide at some point later down the track, or maybe I'd like to try a Medicare supplement plan, it's not always possible. And so it's important to consider your options carefully when you first become eligible to think about whether you might like to be on a Medicare supplement, might like to guarantee your acceptance into a Medicare supplement plan now.
I knew you'd knock that one out of the park. Another question about Medicare supplement. Can individuals go to any doctor that takes Medicare in any state?
Yes, it is not state restricted. It's not any sort of area restricted at all. If you have a Medicare supplement plan, you can see any doctor in the country that accepts Medicare. And it's, I haven't seen the latest statistic, but it's something like more than 90% of doctors around the country accept Medicare. And so, yeah, it's very, very widely accepted.
Excellent. So Sandra has a follow-up question here. She wants to know if her husband has Medicare Part A only, is he eligible to participate in an HSA, or does the enrollment in any phase of Medicare make him ineligible? So Richard, I don't know if you wanted to grab that one.
It is any part of Medicare. So even if he's just on Part A, he can no longer contribute to an HSA account.
Okay, that's great clarification. Obviously, there's a lot of nuance with the HSAs and medical savings and so forth. So I have a few more questions here since we have a couple more minutes. We've talked a little bit about Advantage, a little bit about supplement. I'm curious, why is there so much advertising for Medicare Advantage? Is it a better plan than a Medigap / supplement, or is that just profiteering?
Yeah, I can take that one. It's really because Medicare Advantage plans have become popular because they were set up as a way for the government to offer or to allow private insurance companies to offer Medicare healthcare in a more efficient way. And now, as the Medicare market is growing and expanding, obviously these really big insurance companies like United and Humana and Aetna, et cetera, they're benefiting from this increase in scale. And so they're trying to win more and more consumers into their Medicare Advantage plans because that allows them to lower their costs and become more profitable. And now, while it might seem like it is kind of profiteering by these companies, I mean, they are publicly listed companies. They have shareholders that they're trying to make a profit for, obviously. It really does result in better benefits coming down to the consumer. So each year, more and more plans are offering these extra benefits, like I talked about earlier today, and the value of those extra benefits are also increasing. And on top of that, there's more and more plans available to consumers each year. So consumers have more choice, although it can make it more difficult to choose, but that's what our platform will help you do, is to sift through the different options and all of the benefits that are available to find a plan that works for you.
And I might just chime in there as well. Like, a lot of these carriers actually carry both products. So they also carry Medicare Supplement, Medicare Advantage. So there is a lot of advertising on the Advantage side for exactly Tom's reasons: more competition, better benefits for consumers. I think what we would always say is that doesn't necessarily mean that Medicare Advantage plans are bad for certain people. Again, Medicare is not one size fits all. Depending on the situation, Medicare supplement plan might be what we recommend because you do need that comprehensive coverage. But, there are some, people who are really healthy. There are some plans in Medicare Advantage that provide a lot of benefits, and there's a maximum cap of out-of-pocket spend each year of like $2,000 to $3,000. And if that person is super healthy and doesn't feel like they're going to go and see the doctor much, then that might be a better choice. And so it always comes down to what are the benefits that you're looking for, what is the right level of risk that you're willing to take on in terms of out-of-pocket costs. That's going to determine what plan you should be in.
So we have a question here. Is Medicare supplement the same as original Medicare? Are these terms being used interchangeably? I know a lot of these terms sound the same after a while, so maybe a quick clarification.
Yeah, sure. So original Medicare is that kind of foundation of Medicare that most people enroll in. So it's made up of Medicare Part A and Medicare Part B. Medicare supplement plans are those additional plans that you can purchase that kind of sit on top of your original Medicare and help cover the out-of-pocket costs that you typically have through original Medicare. So they're really just a simple insurance policy. You pay a monthly premium for these Medicare supplement plans, and in turn, that Medicare supplement plan will pay for your out-of-pocket costs that you would ordinarily have to pay under original Medicare Parts A and B.
A couple more questions that just come in, but we have on the screen here a Medicare Advantage open enrollment period. I don't remember. I don't think we talked about open enrollment. So maybe just for a minute, what is open enrollment and what is Medicare Advantage open enrollment, and what are the differences and why is that important to know?
Yeah. Thanks, Joseph. And I'm glad you brought that up. And yeah, we didn't really get to touch on the open enrollment periods. Most people would know that there is what's called an annual enrollment period, which happens from the 15th of October to December 7th each year. So that's when you can switch plans, whether you're on or sign up to a new plan as well, for Medicare Advantage and Medicare supplement plans. And that's the main part of the year when most people make a change. What a lot of people don't realize, though, is that there's also a secondary period, which is from January 1st to March 31st, that allows people who are currently or who were enrolled in a Medicare Advantage plan as of January 1st of each year to make a change to a different Medicare Advantage plan or to disenroll from a Medicare Advantage plan and re-enroll in original Medicare. And so it's called the Medicare Advantage open enrollment period because of exactly that reason. It's only available to people who are currently on a Medicare Advantage plan. So obviously, there's only 15 days left now of the Medicare Advantage open enrollment period. So I'd encourage anyone who's listening or any of your friends, if they are currently enrolled in a Medicare Advantage plan and interested in making a change, you do have a couple of weeks to do that now. Otherwise, you will need to wait until the end of this year for a new plan that's effective January 1st, 2023.
That is very helpful. So you had stated that new plans are being added to Medigap every year, but you also mentioned that there are 10 plans, A through N, I believe it was. Can you explain what you mean by, and this is a question from one of our viewers, can you explain further what you mean by new plans?
Yeah, I can do that. So maybe, Tom, it's worthwhile bringing up that chart that we had on the left-hand side, right-hand side. So I think what Tom was referring to was really the right-hand side of the options that you have, which is Part C, Medicare Advantage. Medicare Advantage plans are becoming more popular, and that's the side that's growing in terms of new benefits. In terms of that's probably the plans that you're seeing marketed on TV. Medigap is actually an alternate name for Medicare Supplement, and that sits on the left-hand side, which means that's part of this original Medicare bucket. You're staying in the government program and you're buying gap coverage, and so there are only 10 standardized plans on the left-hand side of that chart.
Excellent. So we're running down out of time here, but I have one more question from a viewer, and then we could wrap up. And obviously, people can always get in touch with us. But is it true that there are doctors that accept Medicare who can bill you for the difference on the bill that Medicare doesn't cover? Is that is that clear?
I think so. So what you might be referring to is something called the Medicare excess charges. And so this is an amount that a doctor that does accept Medicare can actually charge you for services, and it's limited to 15% above the standard Medicare rates. And so a doctor can charge you up to 15% more than the standard Medicare rates. Now, under a Medicare supplement plans, this is when that would be relevant just under Medicare supplement plans, because you are still using the original Medicare and so Medicare rates. With a Medicare supplement plan G, it will cover those excess charges as well. So it will cover that extra 15%. Now, one of the other differences between a plan G and a plan N is that a plan N also doesn't cover that 15%. So a plan N has those extra copays, and it also doesn't cover those excess charges. So you are responsible for paying that extra 15 or up to 15% if the doctor does charge that.
Appreciate
just
that.
to clarify, that doesn't apply to Medicare Advantage. When you're in a Medicare Advantage plan, the prices you pay are determined by the list price that is on the Medicare Advantage plans. And so only in original Medicare can you be charged an excess charge, and you can have that covered through a Medicare supplement plan depending on what you pick.
Yeah, and there's a little confusion. Someone just asked, is Medicare Advantage the same as Medigap? So I know the answer is not. So maybe you can just quickly pull those apart.
Yeah. And so there's a lot of terminology, and we will send a booklet around after this webinar that actually has this chart. I think it's very useful to have this when you are all looking at Medicare. Medigap is another name for Medicare Supplement, which is that red box on the bottom left-hand side of the chart. And so that sits in the original Medicare side. So that is private coverage, that is gap coverage, that covers the gap in costs under original Medicare. So that was the 20% co-insurance, that was the $1,500 hospital deductible. Medicare Advantage is a private alternate to everything on the left-hand side of this page. So when you go into Medicare Advantage, that is a private plan that is bundled and includes A, B, sometimes D, and sometimes extra benefits.
Appreciate that, Richard. So I want to thank you both, Richard and Tom, for amazing presentation, answering all these questions that were coming left and right. We covered a lot, and hopefully we helped a bunch of people clarify the process of choosing a Medicare plan. I thank everyone who joined us today, live on Facebook and here on the Zoom. We will be making the recording available to everyone, and we'll send out some slides and other information. If you would like to get in touch with us, you can always reach us at hello@CoverRight.com. Check your email for the follow-up from this event, and stay tuned for additional events every month going forward. And you can also visit learning.coverright.com for a robust platform full of videos, podcasts, webinars on Medicare topics. Thank you all again. Have a great day, and be in touch.
Keep going.